Good morning. My name is Ali Bazarbachi. I work at the American University of Beirut in Lebanon, and I'm happy to be here at ASH 2019 in Orlando and to talk about novel treatments for GvHD prophylaxis. So basically, for a long time, calcineurin inhibitors such as cyclosporin with short methotrexate was the standard of care for prevention of GvHD. Then we had major developments about the use of anti-thymocyte globulin before transplant, which became standard in transplant from match unrelated donors and even in many centers for match sibling donors. And then you know about the recent development in the last decade of haploidentical transplant based on the use of post-transplant cyclophosphamide that has made haplo feasible option with prevention of the life-threatening GvHD. And in this ASH meeting, there was a plenary talk about a randomized trial for the use of post-transplant cyclophosphamide, not in haplo, but in match-related or match-unrelated transplant, randomized against the old standard of cyclosporin and short methotrexate. And this study, this randomized trial, showed a major benefit for the use of post-transplant cyclophosphamide in reducing GvHD and in improving GvHD-free and relapse-free survival. And similarly, in this ASH meeting, we had an oral presentation with Georgia Battipaglia as first author on behalf of the EBMT Acute Leukaemia Working Party on more than 2,000 patients with matched sibling donor for AML who received either post-transplant cyclophosphamide or anti-thymocyte globulin. And this study clearly showed that anti-thymocyte globulin reduced chronic GvHD with no negative effect on leukemia-free survival and overall survival. So basically, we now have new standards that are either anti-thymocyte globulin or post-transplant cyclophosphamide for GvHD prophylaxis that are replacing the old standard of calcineurin inhibitor and methotrexate.